The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host for today, Rebecca Miller, along with our co-host, Otto Lohse. Good morning, Otto. How are you?
I'm good, Rebecca. Good morning to you also.
Good. All your technology, everything's working now. You're all, we can see you and hear you, and
all is well at this moment.
All is well. Awesome. And of course, Christina Liu, our Project Independence and You radio show producer who pulls these shows together every week with great guests, including today's guest. And we're going to get to Dr. Sobota in just a moment. And also, of course, Dan Cox, who is the executive director who runs 88.1 FM, WCWP.org for us, and a friend of Project Independence and You for well over a decade. So today's guest is Jacquline Sobota, and you are a DMD, PhD, interim, also the interim program director for the General Practice Residency Department of Dental Medicine at Northwell Health. So, and you're going to be talking to us today about a topic that I know Otto was really hot to get someone to talk about, which is oral health for seniors. So first of all, welcome, and thank you so much for joining us today and giving us an hour of your time. Hopefully you knew you'd be here for an hour. And we look forward to hearing some of the issues and what happens to our mouth as we age. So again, thank you so much for joining us.
Thank you so much for having me. I appreciate the invitation.
Yeah,
I just have a basic question. Is the Department of Dental Medicine, is that a school and also a dental care provider?
No, we currently don't have a dental school at Northwell, but the dental department encompasses many different specialties. So we have residency programs in general dentistry, which is the program that I direct, as well as pediatric dentistry, oral surgery, and oral pathology. So we have training programs and providers in all of those areas.
So it seems like, even as we get older, and this is nothing personal, I do go to the dentist twice a year, but at least minimally, it's not not that doctors are popular to have to go to anyway, but people are really afraid. They kind of associate teeth work getting with pain, I think, for some reason. So you might have like a bad reputation even before people come to you, and really people should just be going on a regular basis just for cleaning. And I think even as we age, there's definitely a misnomer that people feel like, well, like maybe someone who hasn't taken care of their teeth their whole life, does it really pay to start doing it now? So just kind of like, I'd love to hear from your view, geriatric dental health, what the whole, just kind of like an overview of what we should be doing.
Well, I think, first of all, you mentioned that we have a bad reputation because of the association with pain. And I think a lot of people are surprised when they come to us for the first time, how painless, modern dentistry can be. I think, I see a lot of patients, especially older ones, that have had bad experiences in their childhood. They tell me that local anesthesia wasn't used, and they're traumatized from those past experiences where they had, painful treatment at the dentist, and as a result, deferred treatment possibly for many years until there was a real problem. But the truth is that the majority of treatment can be performed with minimal to no pain. Sometimes there's a little bit of postoperative discomfort depending on what's done. But I think that, I always try to convert my patients from that belief that dental work is painful. So I hope I can convince, some more people of that fact.
You're right. I agree with you. I don't think it's pain really as much as discomfort. The idea of having to keep your mouth open for
True.
half an hour, let's say, isn't always comfortable, but they do have these suction things now that
And even with that, we've come a long way. There are special devices that help you to keep your mouth open and suction, and just to make things a lot easier on both the dentist and the patient to give you a better outcome.
Right. And it seems like things have changed so much since I was a kid because, you know, that was your first kind of initial contact with the dentist when you're younger. Your first memory is could be if you had a cavity, you know, and you didn't have Novocaine, if it was like a little cavity, it still hurt. So I think it's like, you know, the memories too
Right.
from
Definitely.
the past.
Definitely.
well,
I
I
mean,
had
even
4 wisdom teeth taken out when I was younger. Whether
yeah.
they should have been taken out or not, I don't know. That's a good question too, by the way.
Mhm.
Should wisdom teeth be taken out? But I do remember the experience, and it wasn't great at all because it
Okay.
was a
Were
long
you
Sorry.
time
awake
ago.
for that, Otto?
Yeah,
Wow.
yeah. And it's kind of a weird feeling when they push
Yeah.
and, you know, but is that a fact though, that wisdom teeth should come out?
It's a case by case situation. Sometimes they do need to come out, but it's not a standard for every single person that it needs to. So we
Is that
evaluate.
because of the takes up space in your mouth or?
Sometimes the wisdom teeth create problems for the other teeth in the mouth, either by making it difficult to keep them clean. They can develop decay more easily because they're difficult to access and keep them clean. So if they develop cavities, they're often recommended for removal, or if they're causing damage to the teeth in front of them.
Yeah, back in my era, it seemed like that was the thing to do. I remember everybody
Yeah,
talking about, oh, you got your wisdom teeth out.
yeah, it is pretty common.
Yeah.
Yeah.
Hey, we should
So
do a survey. Rebecca, did you have your wisdom teeth been taken out?
I did. But I think I had two at a time, and I think they like I had laughing gas or something like that. I don't. It wasn't as traumatic, you know, as having if I was awake for that, and I am totally paranoid of anesthesia. But that I was much younger. I was like 20 or 21.
Mhm.
Yeah, I had them all out, but I was not awake. But I do remember my son having to have a tooth pulled, and he had a huge needle in his. I mean, it was really traumatic, and I don't even know if it hurt as much as it was the whole being awake. And like to this day, he is so paranoid to go back. But now, we have a great dentist, and she has to like baby him a little bit. Don't tell anybody that I said that here, if anybody's
See,
watching.
my
So
dentist doesn't show you the needle. He sneaks up
Mhm.
and
just jabs it.
catches you without
He's
seeing
like,
it,
is
which
that a
is a good,
butterfly?
is that a
Really better
technique
not to
that's
look. It
taught?
shouldn't hurt.
Yeah. Yeah, but it's definitely changed so much, and
Mhm.
the way that they even, give the shot, they numb it a little bit. So, I mean, the most important thing, obviously, is to get there before you have problems. But I think as we age, the mouth does change, but it doesn't mean that you should give up, and especially if you haven't really been someone who's flossed or done the types of things up to that point, even if you've brushed twice a day and rinsed and all that stuff. So what are some of the common aging factors that happens to the mouth and the teeth, gums?
So it's actually not so much that dental diseases occur with aging. It's just that they become more common in an aging population. Specifically, dental decay and gum disease are the two most common that we see, more as a result of things like medications that people are taking that might cause dry mouth, and those predisposing factors will make them more prone to developing decay, if that makes sense. So when the
Are
mouth is
there,
dry. Hmm,
yeah, are
sorry.
there certain medications that you know of that if you take them, you're going to be a good candidate for that?
There are a
Like
lot
what?
of, yeah, I mean, there are classes of drugs like antidepressants are very commonly known to cause dry mouth. Other like psychiatric medications, blood pressure medications. There are a lot, and it's hard to say whether or not it's going to definitely cause dry mouth, but it's something to be aware of. And if a person does experience that, there are ways to deal with that. For example, drinking more water is, frequently recommended. There can be saliva substitutes that are prescribed. Actually chewing sugarless gum or sucking on sugarless candies can help to stimulate the salivary flow. And this is all really important because the saliva creates this buffering capacity in the mouth to neutralize the acid of the bacteria that causes tooth decay. So when you're missing that saliva, the teeth become more prone to developing decay. In addition, because an older population might have receding gums and more of their root surfaces exposed, they might be more prone to developing cavities on the root surfaces of their teeth. So again, this is really important preventatively to deal with because treating root decay actually is very challenging. So prevention is really the main goal. So treating with fluoride, either in office or at home. I'm a big proponent of home use of fluoride. Even just an over-the-counter mouthwash that you can buy at the drugstore is really helpful to use before going to bed at night and helps to prevent tooth decay and also can actually help to remineralize some very early lesions that are starting in the mouth.
You just said a question that I was going to ask, or your answer to a question, and that is mouthwash. You sometimes tend to look at that like as a marketing tool, if you will, but you're saying that they're actually good to use.
I would look very carefully at what type of mouthwash. First of all, I usually recommend avoiding mouthwashes that contain alcohol, especially in somebody that has a dry mouth, because the alcohol can exacerbate that drying effect. It dries out the oral tissues. So looking to make sure it's alcohol free is really important. And I would say it should have fluoride in it. So fluoride is really important, especially if you're using it as an anti-cavity treatment. There are other mouthwashes that are, marketed to freshen the breath, and that's all fine. But as far as treating or preventing tooth decay, it's really important that the rinse has fluoride in it.
I remember when my kids were younger, fluoride was always promoted in some way. And as we get older, you don't hear that as much, that you need fluoride. But that's really good to know, alcohol free and with fluoride. If I use a stronger mouthwash, I always cut it with water. I just use a little bit and kind of try to elongate it a little bit. I don't know if that's me being cheap, but it also seems that okay, never mind. Next question, Otto, you're up. Well, no, seriously, sometimes when I use mouthwash, it's like you get filmy in my mouth after, maybe if it has like a whitener. I mean, I use, you name it. I'm cleaning my teeth with it. So, but if it's fluoride now, that's what I'm using.
Well, how rapidly can tooth decay happen? Like you go to the hygienist like I do, like every 4 or 5 months, because I have a tendency to, get messed up. But yet I can still show up and wind up with tooth decay, even though I've been going for 4 or 5 months. Is it that fast that it can decay?
It can be. It depends on what you're doing in between those visits. It really is greatly dependent on diet. So eating a diet that's high in sugars and starchy foods will create tooth decay and have it accelerate at a faster rate if you're constantly exposing the teeth to those kinds of foods. Drinking juices, or especially like sipping on sugary drinks throughout the day, the more frequent exposure will also cause tooth decay to progress at a faster rate. So it can actually develop pretty quickly, just depending on home care, and also, again, the use of countermeasures like fluoride and whether or not how good of a job you're doing brushing and flossing.
Of course.
Like I'm sorry, you said sugar and starchy?
Yeah, carbohydrates.
Right. So like pasta or?
It can.
Yeah.
It can.
Just rinse your mouth after the pasta, Otto.
Yes.
Yeah, well, I stopped using the mouthwash
actually,
for a while.
Even just drinking water after having, a high sugar food, or like, for example, if somebody likes to drink coffee at work, or sip on their coffee. Sometimes it's hard to tell somebody to stop doing something like that. But what I recommend is having a glass of water next to it so you can rinse it away, so that's not at least the last thing that's sitting on your teeth if you don't have the opportunity to brush. Brushing is obviously the best way to remove any remaining sugar on the teeth.
Are there practices that are specifically geriatric dentistry that is that a specialty now? I mean, I would think with the population aging, the majority of people, at one point are going to all be 60 and older. We're coming to you. So,
right. Training programs now. It's a relatively new area. Yeah. I don't think it's yet recognized as a specialty, but I think there is a push for that. And there is specialized training that's been introduced to train practitioners to deal with these kinds of more unique problems in this population. But most general dentists should be able to treat, an older patient. I mean, they're not really, if you're well versed in, the medical side of things, I think that's the important part, is being able to understand the patient's medical history and the drugs they're taking, and being able to have a conversation with their physician about any treatment modifications that might need to be done, or any implications that their overall health might have on their dental health. So I think it's important to have that kind of background, but most dentists, I think, probably have that.
Right. Because, obviously the population is growing and and much older, and there are things that do happen, people start wearing dentures. Very rarely do you see younger people, unless they've had accidents, that have to wear dentures, and the implants. And of course, there's also people who've smoked and maybe have quit a long time, but also smoked a long time. I know that you have a lot of information on that, and basically is don't smoke. But we do have to take a quick break. And when we come back, I do want to talk also about x-rays, dental x-rays and imagery, because it's so different from when I was younger, how they did it to how they do it today. So we'll be right back with Dr. Sobota with talking about oral health for seniors. You're listening to Project Independence in You on 88.1 FM and WCWP.org. We'll be back after a quick break.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We've been speaking with Dr. Sobota about oral health for seniors. And I think we just all have so many questions from our own perspectives and, experiences that we're grateful for you to kind of jump around with us a little bit. But just before the break, I'm very interested in like the technology that has happened. There's so many things that are different when I go for my checkups today, between the way they do x-rays digitally, the things they put in your mouth to glow and dry things. I mean, it's like a maze. I mean, I had some dental work a couple of years ago that took several visits, and there's so many products they use. It's just unbelievable. I mean, they're continually opening a gel, like a ray gun, a shot, and it's just like, okay, your teeth look great, so you must be doing something right. But seriously, in terms of the x-rays, how important is it really to get them regularly? And, there's also a thing in the back of my head, is it dangerous? Do you really need to have them more than once a year? And, especially if, like, say, the last 10 years, my x-rays have always been the same, that kind of a thing. So I'm just curious about your perspective on the whole x-ray.
Right. So You mentioned about the risk of exposure to the radiation of
Yes.
X-ray. Now, with the common use of digital X-rays, the amount of radiation that a patient is exposed to is so minimal that it's really not a factor anymore. But that being said, we still try to keep it to a minimum, whatever is the most useful for a patient. So it's basically decided based on the patient's risk of developing tooth decay. So somebody that has had a history of frequent cavities and has many restorations present in their mouth, they might have a lot of crowns, bridges, fillings, things like that. It's important to routinely check on those to make sure that there's no cavities developing underneath. You can't always see those by doing a clinical exam, so x-rays really are very critical for diagnosing decay under old restorations or decay that starts in between the teeth that you might not see clinically until it's so big that it might need a root canal or to be extracted. So again, this goes along with the prevention and identifying problems before they become really a real problem. Sometimes you can even identify a very tiny cavity on an x-ray and treat it with fluoride, and it can reharden on its own by doing that at home. So I think radiographs or x-rays are a very important tool in prevention. For somebody that has a very low risk of decay, the dentist might only recommend bite wings to be taken every year or so, something like that. But somebody that is more frequently developing cavities or has had root canals or things that need to be checked more often, it's a case-by-case basis.
Yeah. Okay, great.
Back to the prevention area.
Yeah.
And brushing. Manual toothbrush, electric toothbrush, your opinion?
They're both good. It's really dependent on technique. So if somebody uses a manual toothbrush and does a good job with it, it's just as good as an electric toothbrush. But that being said, a lot of people don't do a good job with a manual toothbrush. They brush really quick. They might brush either too hard and scrub their teeth and really can cause damage that way. So I personally really like electric toothbrushes because they take a lot of that user error out of it. It's a lot less technique sensitive, especially some of the better ones like the Sonicare or the Oral-B. There's all these different ones that the big brands have come out with that are really easy to use. They're on a timer so that if you let it go the whole amount of time, you're guaranteed to thoroughly clean all of your teeth. It kind of buzzes from to prompt you to go from one section of the mouth to another so that you spend equal amount of time on every quadrant of your mouth. So I like it for that reason.
Okay,
well, I just have to buzz
one.
in, guys. Sorry,
Yeah.
I have a question related to brushing. You see different like bristle types. So you'll see soft or you'll see medium. I was always under the impression that soft was better because medium was too harsh. I didn't know if that's true or if it doesn't necessarily matter.
Generally speaking, we recommend soft. You can cause damage if you're really scrubbing with a harder bristle. And we see abrasion of the root surfaces. In somebody that has it can cause gum recession, and then once the gums have receded, you can actually damage the root surfaces by continuing to scrub.
Okay, so prevention so far, we've talked about mouthwash, we've talked about brushing, and then we come down to water pick / flossing / whatever. What do you recommend as far as that goes? Does water pick take the place of flossing?
I don't think so. I think water pick is a great adjunct to flossing, but I think there's no substitute really for flossing to, again, mechanically remove the plaque that's forming in between the teeth. The water pick is helpful, and actually water picks are a really useful tool around implants because it can be difficult to clean around implant-supported prostheses that can't be removed from the mouth. So sometimes a water pick is really helpful for getting in those areas where you can't necessarily get floss so easily. But I think floss is still the gold standard for cleaning in between two teeth.
So I have a problem with the flossing part getting in there, but I use these plackers.
Those are great too. Yeah.
Yeah.
Anything that will allow you to get in there, there's floss on it.
Can maneuver a little easier.
I know that during the break, we talked a little bit about toothpaste. So, your more popular toothpaste that might have a lot more ingredients in it that some people really don't want to use for whatever reasons, sensitivity to it versus natural toothpaste. So what's the vibe with toothpaste? Is there a better better one to use, or what do you think about that toothpaste?
The general recommendation is to use a fluoridated toothpaste. But to get that full benefit of fluoride, it's important not to rinse it off the teeth. So if you're being prescribed a high fluoride toothpaste by the dentist, that's more than the kind you buy in the drugstore, it's actually really important that you don't rinse it off, or you're not going to get the full benefit. If you do rinse it off, a lot of people think it's kind of gross to not rinse after they brush their teeth. So for those people, I recommend using a fluoride rinse. So if you're using as we talked about over the break, if you're using a toothpaste that doesn't contain fluoride in it, then using a fluoridated rinse is really important for cavity prevention. So as long as you're getting that fluoride in there. And I think there's much better compliance with the rinse, with a fluoride mouthwash, because it tastes good usually, it kind of feels refreshing. And I think the best way to get the most out of that is to use it before bedtime, and you just don't eat or drink anything after that.
Is it a myth
I'm
that
also a big proponent of flossing. There's so many different just like every other type of product, there's wax, non-wax, thicker, thinner. It's like, I use the one that I like. It's like a flatter one, not just like the ones that break easily. Right. Is there a wrong kind of floss? Because some of them, the cheaper ones, I feel can like fray, and then you get that stuck in between your mouth. You have to get a thicker one to, get it out. So.
Right, especially if you have very tight contacts, if your teeth touch and it's hard to get a thinner floss through, then something that's waxed might be better. You definitely don't want it shredding in between the teeth. So I think it's a matter of personal preference and whatever is going to work best for you. If it works, then go for it.
Okay.
Is it myth or is it fact that supposedly there's fluoride in water?
It depends where. Not in Long Island.
No, okay.
But in New York City, the water is fluoridated.
Right.
So, there's a lot of seniors. We're now a country, a state, a government, a local area, town, where not only are a lot of people turning 65, 10,000 people a day are turning 65 until the baby boom generation all hit 65, but we also have seniors living well past their 90s and even into their hundreds. Like, we talk about this a lot. When I was a kid, very rarely did you hear of somebody in their 90s, like their grandparent was in their 90s, or maybe their great grandparent, was in their 90s. Forget about 100. It's common now. We have Project Independence participants that are, a lot of them are in their 90s and hundreds, and so there is always, there's a lot of unknowns, I think, for a lot of reasons as we get to that point. For us as, trying to provide services, appropriate services for people that are that much older, they outlive a lot of their own family sometimes. So, people seem to feel that they don't have to really take as careful care of their teeth. I feel like as people get older, maybe just brushing, things spacing. Sometimes they just, decide to get a tooth pulled instead of maybe doing other work or other possibilities. So those kinds of issues that come up in, much later years. And it happens to a lot of young people too. If there's might be a cost factor, or, it's just not an important, they don't have that understanding that, really your mouth is the first entranceway into your body. Right. And, you want to make sure that it's as, proper and clean as you breathe in and eat. So I don't know, these are the issues that I think a lot of our listeners are curious about too, that end of aging, and how important it is, no matter what age, to continue to take care and see your dentist.
Yeah, I think it's important for anyone of any age to continue seeing their dentist with regularity. I would say at a minimum every 6 months, again, at the very least for prevention, but it's never too late to treat, a problem. We see patients in their 80s that were placing implants, when you're missing teeth, you might not be able to chew as well. Aesthetics may be a concern. I mean, you want to have a nice smile. So some people do it for aesthetic reasons, but
I'm in that boat right
but
now. Tomorrow morning, I'm going to have a permanent crown put on one tooth, and then I have to make a decision. The way I see this whole thing, I think we had a very good ideas here about prevention, and then okay, you prevent to a point, and something happens. Now you got a repair issue.
Right.
Do you need root canal, fillings, whatever? And then you go past that, and then you have a replacement issue. If the repair part's no good, then you get into replacement, which is a whole nother subject, which I'm involved with. Also, I didn't skip any of them. I went right through all of them. But repair, like like a dentist, you have to trust to make the decision for you that a crown or root canal or filling or whatever, repairs can be done to what's there. What's the judgment call that a dentist makes on that?
I think everybody has different philosophies on that. I mean, personally, I think if you can save your own tooth is better than either no tooth or a fake tooth. So if you can save your tooth, I think you're never going to find something better. But if a tooth cannot be saved and you are missing it, you feel like you can't chew as well, or you don't like the way it looks, then there are replacement options, which could range from either a bridge, depending on whether or not there are teeth on either side of that missing tooth, an implant to replace it, or sometimes removable dentures, either partial dentures to replace a few teeth, up to a full denture to replace all of the teeth should they be lost.
Yeah, that's where I'm at right now, to be honest about it. I had a bridge for many years, and the bridge tooth base got infected. So therefore the bridge had to come out.
Right.
So now you have a gap where the bridge was, and now you have to make a decision. What do you do? And I'm pretty aware of the options now. But I do have some questions, like the denture point that you mentioned. I recall a term flipper where you could insert a denture which would be semi-permanent. Is that?
It's not really semi-permanent. That's actually, it's very removable. A flipper usually is a single tooth or just a few teeth that are meant as a transition to a more definitive prosthesis, whether or not it's a more definitive partial denture, which might be a little sturdier, or again, a bridge or an implant. But flippers are really meant mostly for aesthetic replacement of teeth. So for example, if somebody loses their front teeth and they don't want to be without a front tooth, we make a flipper which comes in and out. It actually has to be removed even for eating because it's kind of flimsy. It's made of plastic, so it's not functional. It's purely for aesthetics, but it's an interim type of prosthesis to kind of get you through that period until you're ready to have that implant or bridge.
Now, like a denture, like a bridge, basically messes up the two teeth that are good because they have to cut it down or do whatever to attach the bridge to it. Does that happen with a denture as well, or?
No, so a removable denture does not really involve cutting down or preparing the teeth in the same type of way that a fixed bridge would, which is which permanently is cemented on top of the, like you said, the teeth that are on either side of that missing tooth to anchor the bridge. So it's a little less invasive from that point of view to do a removable prosthesis. And you can also replace a lot of teeth with that, as opposed to a bridge, which is really, depending on what teeth are remaining, it may or may not be a good option. And like you said, it does involve cutting down teeth. So if the teeth that are to be utilized are healthy teeth with no cavities and no existing restorations, it may not be the best idea to subject them to that treatment. And sometimes it might be better to consider an implant, which is sort of a standalone treatment and does not involve the adjacent teeth.
Now, an implant, as you get older, is also a little bit of a catch-22, I think, isn't it? And that the bone part of your mouth, where the teeth are held, is not as strong or as good as it ought to be
You
in
know what,
terms of
Otto,
an implant?
let's take a
Yeah.
quick break and then we'll revisit that question. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We will be right back after a quick break.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I am Rebecca Miller, along with Otto Lohse, Christina Liu, and Dan Cox. We have been speaking with Dr. Sobota, who has been giving us such great information on oral health for seniors. And just before break, Otto, you were kind of in the midst of asking a question. So if you want to just revisit a little bit and then we can carry on.
Well, it all wraps around really, the need for replacement when you get to it. How do you do it? Like the denture part of it, would the denture be semi-permanent, even though it's removable? Could you have a denture that's more stable, if you will, than a flipper type?
Yes, you can. So we can make dentures that are more stable and sturdier and can be used for function. They still are removable, so they need to be removed at night. We never recommend sleeping with them. The nice thing about that is for hygiene purposes, it's very easy to maintain the hygiene of the teeth and also of the denture because you can take it out to clean it. It can actually be very challenging to clean fixed bridges, which are all connects all of the teeth. So getting floss underneath can be really challenging, especially if manual dexterity might be limited. That could be really present a set of challenges as well. So removable dentures are a great option in many cases.
It sounds like, fortunately, I do have conversation with my dentist, but it sounds like what I'm saying for other people is not to be afraid to talk to your dentist about
Absolutely.
what's important to you. Is it important? Like,
Yes.
can you function? Can you chew food? Do you care about how it looks? Like some people are very self-conscious about, having missing teeth or whatever. Some people, they don't really care. And that's your option. But I think these are things, cost, frankly, we never mention cost, but I think the dentist is probably one of the most expensive propositions that people have, especially because there's, Medicare helps a lot as far as medical goes, but, clearly Medicare does nothing for the dentist part of it. And that's another subject which we can talk about a little bit. But I think the key thing to me is you got to be able to have an open conversation with your dentist.
I totally agree. I think it's really important that when you go to see your dentist, you have an idea of what is important to you and what you're looking to accomplish from treatment. It might not be important to you to replace a second molar. If you can chew just fine without it, then there's no point in placing an implant. But some people might, depending on how they're feeling, if they feel like they need the tooth to function, again, aesthetics, all of those things are really important to bring up, as well as the time frame of some of these things. Implants take a longer period of time to complete the treatment in many cases, whereas making a removable denture, it takes several visits to accomplish, but by, within like 2 months, you should be able to go home with it. Whereas implants, a lot of healing time in between each step.
But you see ads about implants, come in and get your implant and go home the same day.
Yeah.
I've had an implant and it doesn't work like that.
Very often it does not.
A little bit of marketing deception, I think. Not by good dentists, but by organizations that, push things like that.
I do like what Dr. Sobota said in an earlier segment. It's just like, which is things we talk about a lot, is you're never too old to take care of your mouth. I mean, you need to continue to take care. And I feel like people, as they get older, may question it. There's the cost factor. I mean, if I'm in my 80s, do I really want to do this? And I feel like, yes, you have to value yourself. You want to still feel good. You want to be healthy. You want to look good. I mean, take care. 80s today, it's, what, look at Otto. It's like the new 30, 35, right? And
86 and a half.
Yeah. So, you want to continue to invest in yourself, in your teeth, in your mouth, and how you feel about it. I feel like people have kind of, well, I'm getting older. It's expected. This is expected. But you can change things. You can, make yourself. So I love that Otto is, going forward and talk to your dentist about it and, the best options for you in terms of, cost, longevity, and there's also the factor of, if you're retired, you might have even like a little bit more time to take care of your teeth in a different way than someone like me. Like if I had a choice between a denture, a flip, or whatever, an implant, at this point in my life, I would probably go for an implant just because of my lifestyle. I don't have time to, take the denture out, rinse, whatever the process is. So there is a lot of options. You just have to find out what works best for you by talking to your dentist and, valuing yourself. You're always worth it.
Well, another direction, and Dr. Sobota, you could back this up somehow. If you don't take care of your teeth and your mouth, it impacts other parts of your body as far as health
That's another
goes.
great point, is that if you neglect your teeth, it puts you at risk of developing infections in your mouth, which can actually spread to other parts of your body. So causing neglect just because you think, I don't know, that it's not worth investing the time or the money, it can actually lead to real health problems. I mean, patients that have prosthetic valves in their heart could be at risk of developing an infection of those, endocarditis, things like that. I mean, once bacteria enters the bloodstream, it can go to any part of the body.
Right.
I know when I had to remove the infection, I didn't really want to because I didn't have any pain. But when the x-ray showed that there was an infection, and it was clearly told to me that it's a risk that you take, that if it could travel to the rest of your body or some other parts of your body.
Right.
So, I said, okay, I'm going to have to play the game and get rid of it, even though it didn't hurt, but it was there and it was a problem.
And, that's another good point about, you can have dental disease without even knowing that you have it. It might not necessarily hurt. Gum disease is a really good example of that, which by the time it does hurt or results in loose teeth, it's often too late to really do any effective treatment besides extracting the teeth. But treated early, you can really halt it, in its tracks very early on and prevent it from progressing. But treating it is not only helpful for preventing the loss of teeth, but there's actually known interactions with other diseases, for example, diabetes. Controlling gum disease or periodontal disease has definitely been shown to have a link with diabetes. So patients with poor diabetes control often have poor gingival health, and vice versa. There's definitely a clear link between that. So getting your gums in good health actually can benefit your diabetes control.
So I'm just going to put this out there. Halitosis, right? So bad breath. So bad breath, I know, can come from stomach issues. It's not always, directly related to the mouth. But, I've noticed even, I know it's going to sound gross, but with flossing, sometimes there'll be like I'll be like, oh, what was in there? And then, I floss, make sure it's clear, and I'll rinse. But is that a sign of, if it's like related to the mouth, dentist, bad breath?
Well, it's the most common thing is by not thoroughly removing the plaque from in between the teeth. So if you're if you're smelling it when you're flossing, you're removing it. But
Right.
that's what's causing the bad breath in many cases, is not flossing and just letting that kind of simmer in the mouth. And
Right.
that's, you know, leaving it there is going to cause that. So flossing it out is definitely going to help, and, you know, good hygiene practices.
Right.
Dr. Sobota, you're going a little bit marketing wise here, okay? Your Northwell Health is a full-blown provider of dental care.
Correct.
And if we have people who do not have a dentist or whatever, and they wanted to contact Northwell Health Dental Care, what would they do? How would they?
So there's a lot of different options, actually. So we have both faculty practice options, where you would see someone more experienced like myself, or we also have residency training programs, which is actually a really great option for people that don't have dental insurance, especially if they're looking for implants. We have an implant fellowship at North Shore Hospital, at which the residents stay past their first year for 2 additional years of training, and are learning to place and restore implants. So there's a whole variety of options in that respect, as well as for seeing specialists. We have a large oral surgery department, a pediatric dentistry department within within the Department of Dental Medicine. So there's different contacts for each I guess, clinic and different practice. We now have several different practices. Again, they're the faculty practices that are outside of the hospitals, in addition to the larger residency programs that are within North Shore and LIJ.
Suppose somebody wanted to contact Dr. Sobota because they liked what they heard, and they would like you to be their dentist.
Sure.
What would they do?
Would you like the phone number?
Sure.
Sure.
The faculty practice phone number where I'm at North Shore Hospital in Manhasset is 516-562-1300.
And of course, any of our listeners, you can always call 311 or the town's, call center directly by dialing 516-869-6311. And Christina or I'd be happy to give you the contact number for Dr. Sobota.
An area that does come into play for many people is the cost of going to a dentist.
Right.
I haven't been able to find a dental insurance that is worth talking about unless you happen to belong to an organization or a union or whatever. But for most people, to my knowledge, and I'm not looking to put you on the spot, but you know, are there good dental insurance plans?
I don't know. I mean, I guess it depends on what your needs are. The problem with a lot of these plans is if you do have significant needs, you end up maxing out very quickly anyway. So I'm not sure how good they are. It's probably most useful for somebody that has minimal needs, maybe 1 crown, 1 or 2 crowns, a couple of fillings. But once you exceed that maximum, you know, then you're paying out of pocket anyway. So I'm not sure. I don't really know of any great plans that I can recommend.
Right. They're mostly all like a discounted option. There's even though they're insurance, there's deductibles, and a lot of dentists will opt in to the plan and just offer, they're participating in this plan and they'll offer the discounts. So, I think that if you have a dentist and you work with them, they are not shocked to know that it's expensive to be a dentist. I mean, for them too, especially that's what I was like kind of alluding at too.
Yes, 2 sides to the story.
Yeah.
All of the preps and technologies and tools and cleaning. I mean, I like to be in a practice. I want to see that everything is open, fresh. Everything is new, and there's so much hygienic stuff. They cover things. And that's just for one person. And I mean, if they're saying, so there is a lot of expense on that side. I mean, that being said, it's expensive.
Well, COVID added a lot to that, I believe also, that what the dental people had to get to be able to function during COVID.
Even before that, I really have to say, that's why I love my dentist. She is, I mean, they are just so careful, and because it's so clear. I mean, you're putting something in someone's mouth to drill. You've got to make sure if that's the next person that comes in, that handles change, that everything's cleaned. I mean, it's intense, and I could see that it is super expensive. Are there, sometimes there are oral surgeries and things that would be considered medical, I believe, too. I don't know in terms of, dentistry and teeth, but other kinds of oral surgeries, I'm sure covered.
I think so. I'm not as familiar with those, but yes, I know that most of our oral surgeons participate with medical insurance plans as well.
Right.
So when they will take patients to the operating room, and certain procedures are covered by medical insurance.
Right. So, that's obviously you always have to research and call your insurance company and find out about that. So, I mean, I know that I read something somewhere, and I don't want to misquote anything, but I do think I read where there was a plan to start opting in more services from the dentist into Medicare, or maybe it was Medicaid. I'm not 100% sure, but I did read something.
Medicaid.
Right. Okay. So, which is important. I mean, it could get, help with lots of long-term ailments if you're not able to get to the dentist. But I feel like a lot of dentists are fair when they know and will, try to work with you. I mean, they're like you were saying, even with the residents, and might be an option, especially, and their residents are, dentists. I mean, they're just they're supervised there, so that's really a great option too. A great option for that. But so for seniors again, what are just some of the things daily that they can do and not kind of feel like, why am I bothering? I feel like it's so important for people not to have that attitude that you can still change your oral health, if it hasn't been the greatest at any age.
For sure. I think that, just starting with the basics, brushing and flossing, find what works for you. If an electric toothbrush will work better because it doesn't require as much skill to really do it effectively, I think that those are great. They work really, really well. Great. And the same thing with floss. If you find it challenging to use regular dental floss, there are other options. Floss that comes on a stick. There are interproximal brushes. There are little brushes that you can use in between the teeth, which work really well for a lot of older patients because they have recessed gums, receded gums, and there's more space to get those little brushes in between. And that works really well for cleaning out in between teeth as well. Using fluoride rinses, highly recommend for everybody. I think that that's a really effective prevention tool. So getting some of that and using it before bedtime at night, and watching the diet, making sure that, to minimize the exposure of the teeth to, sugars, especially. And
back to basics, like just
But that was just one quick question. You said at night. Is it best to use rinses at night?
I think so, because you're not going to eat or drink after, and you're having that effect of the fluoride sitting on the teeth all night.
Okay.
Well, I have to actually thank you so much, Dr. Sobota, for joining us today. It was a quick hour, great information. Anybody listening certainly could call 311. We're happy to give you the contact information. You're listening to Project Independence in You Community Talk Radio, 88.1 FM and WCWP.org.